Good morning.
Thank you very much indeed for taking the time to talk to us. I must ask you first of all about those latest figures we've got out from the Office for National Statistics showing the economy has contracted by 0.5 percentage point in July. Big concern on that, particularly as we've seen those wage rises yesterday, the latest wage figures, more than inflation, thankfully, at this current time. But how concerned are you about the direction of the economy?
Well, I think the ONS, when they've released those figures, have been pretty clear that a major factor in that is the strike action that's been happening, and that is having an impact on growth. But also our forecasts only this week show actually that, more positive news in terms of future growth and our performance compared to some of our neighbouring countries, that our forecasts are far more positive. So, today's figures are disappointing, but it shows that also our kind of mission to tackle inflation is the right one, because while inflation is high, it affects, the purse strings of every household, but also businesses, and that has a knock-on effect growth as well.
Well, I mean, it certainly does, and it's certainly going to have an impact on what the government has to spend in terms of tax take and the like, and paying for things like pensions. Lots of people think that they pay money as they're working throughout their lives and it goes into a little pot, and that pot is sitting there waiting for them when they retire. You know as well as I do that isn't the case. That money is spent, real time in the year they actually pay that tax. And there is a concern that we simply don't have enough money to pay out the commitment to the pensions triple lock. On basis of the wage figure increase yesterday, we'll be looking at state pensions under the triple lock, which guarantees goes up by inflation, earnings, or a minimum of 2.5%. People could be getting 8.5% increase on top of 10% last year. Mel Stride, the Work and Pension Secretary, says this is unsustainable long term and could have to be watered down. Do you agree?
Well, I think Mel was talking about, the real far long term. And if you look at what we've done for future generations of pensioners, we've introduced the workplace pension. So currently, many pensioners are just reliant on the state pension. That will change for future generations, because they'll have the state pension as well as their workplace pension. And so there will be changes in the future to come. But for now, for pensioners today, we the triple lock. We're committed to the triple lock. We kept it last year when it was quite high with inflation, and we've committed to keeping it this year as well. That's in addition to the support we've given, particularly with the winter fuel allowance. So last year they got an additional between £200 and £300, depending if they're a single or a couple. And again, they'll be getting that this year, as well as additional help that was given through the cost of living. So we have shown that we understand the pressures that pensioners face, and the triple lock, we've committed to it, but we've given additional support when it's needed as well.
Well, OK, let me also ask you about the long-term sick. I want to get on to your particular area, looking back at mental health. But this ties in, actually, in terms of dealing with these issues. But we've got 2.6 million people long-term sick. A lot of them are waiting for NHS operations. A lot of that's going to get worse. Well, it's got worse with doctors' strikes. It's going to get worse with the NHS crisis in the winter, because we go from a summer crisis to an autumn crisis to a winter crisis. How does the government plan to deal with those issues?
So in terms of this winter, we are absolutely kind of rolling out our plans already, and that's why the Prime Minister and Secretary of State have been very clear on that. Whether it's ramping up the vaccine programme, which has started this week in care homes, to make sure that the sickest and most vulnerable stay as well as we can keep them over the winter period, but also our capacity in hospitals. We've created 10,000 virtual beds, so to try and keep people out of hospital and get care at home, but also to 5,000 permanent beds in our hospitals to build up that capacity. And we've also ramped up our social care capacity too. We've got more people working in social care now than in the NHS itself, and we've reduced the delays for care packages by about 12%. So, we don't know what kind of ill health will experience this winter. Last year we saw high levels of COVID, we saw an outbreak of strep A, and we had high levels of flu as well, which don't just affect patients, but they affect staff too, with staff sickness. So the plans for this winter are pretty robust. But we will, face those challenges as they come, sometimes before Christmas, sometimes after.
Yeah, except we know that there's going to be extra beds in hospitals for the winter period, but a lot of those won't arrive until late January, early February. Yes, often we know that is the time when there is peak time, but if it comes early, we're not prepared. Every year we seem to be shocked that there is extra demand for healthcare during the winter months, and it comes as a complete surprise to everybody. Why?
Well, you're right. So traditionally, after Christmas is often in the winter months are often the busiest period. So we've got the capacity coming when we expect the peak. But we have been working year through. So if you look at our Category 2 ambulance wait times, we've halved those this year because we are putting in that extra capacity, because we are discharging people from hospital quicker. On average, we've got about 2,000 extra beds a day because we are now getting discharges through the system much more quickly. So there is extra capacity coming for winter, but we have put extra capacity year round to build up that resilience so that we're starting in as good a place as we can before any future winter pressures come along.
OK, can I also ask you something Wes Street in the Shadow Health Secretary just mentioned? We were talking about issues with doctors going on strike. We know we've got more doctor strikes coming up later this month. Why has the Health Secretary, Steve Barclay, your boss, why has he not met with the BMA representing striking consultants and junior doctors for many months?
So we met with some of the other health unions earlier in the year and reached a settlement on that. Over 1 million NHS workers, including nurses and physios, got their pay rise, and we resolved those disputes. And the issue with the doctors and the consultants is their demand. 5%. We have given junior doctors between 8 and 10% this year.
Would you mind answering the question?
So we've been very clear that we can't meet a demand of 35%.
Why does that mean that the Health Secretary can't meet with the people? I don't think anyone realistically thinks that the doctors think, yeah, we're going to get 35%. They know they're not going to get it. You know that's an opening salvo. You know you're not going to pay them less than you've paid the other people. So we know we're into a ballpark of where you're going to give what sort of sums. Why does that mean that the Health Secretary hasn't met with them? The only way this is going to be resolved is with talking. Someone's going to have to back down. Both sides are going to have to back down to a certain extent. Why has the Health Secretary not met with those doctors' unions for months on end?
Well, he has met, over the months with the BMA, with the Junior Doctors Committee, but also with the consultants. And it was because he met with the consultants that the Chancellor announced earlier this year the reform to consultants' pensions ceiling limits, which they said were really having an effect on retention of consultants because they felt they were paying to come to work. So we have met with them and we've listened.
But not to discuss this particular strike action, though.
Well, I think we've been clear that the time for negotiations is over.
What do you mean? I'm sorry. So people are literally dying because they can't get health treatment because it's been delayed. Everyone listening and watching this will know someone who's had an operation that's been moved. I had an elderly aunt who just had an appointment that was cancelled because of strikes, moved by 6 months, for goodness sake. Thankfully, it's not something vital. But people are dying because they're not getting health care at the moment for various other reasons. Every time there's a strike date, more people are dying as a result of that. And you think it's OK the time for talks is over?
Well, we have met with them, and we came to an 8 to 10%.
When was the last meeting with the BMA representing junior doctors and/or consultants? When was the last meeting?
I don't have the exact date of the Secretary's.
Give me a month.
Well, I know that he was meeting them just before the summer.
So before the summer, so May.
I don't have access to his diary.
But all summer, I mean, it's mid-September, and we've got ongoing strikes by some of the most crucial workers in this country, people who literally have the job of keeping people alive, and they're taking off 2, 3, 4 days at a time, and people are dying as a result. And the Health Secretary, Steve Barclay, has not met with their union representatives.
Well, he has met with them, and he's had
over the summer.
He has met with them, but they are pretty clear that it's 35% or nothing. And we've given 8 to 10%, a similar deal to which they accepted in Scotland. They accepted 17% over 2 years, but they haven't accepted our offer of 8 to 10%. And likewise with the consultants, we've been, they've got a 6% pay rise. That's over £6,500 a year that we've put in front of them. And they've said no, that the 35% is what they are after. There has to be a two-way conversation. The door is open for future negotiations, but it does need to be realistic. We can't, you've heard from West Street, Labour aren't going to give 35%. No. We can't afford 5%. The door is open, but it has to be about realistic negotiations.
Okay. Just Just finally, I want to ask you, one of your responsibilities were for mental health and women's health strategies. Do you think it would be easier to and more constructive to deliver women's health if the NHS used the word woman more often? Whenever there is a campaign about men's health, if it involves, checking your testicles or looking after your prostate, the word man, men, look at your body and see what needs to be done. Is go for a mental health, go for a check on your body. When it's about women now, increasingly it is people with cervixes, or it's referred to new birthing mothers as chest feeders and the like. Do you think that the NHS should, on the orders of the government, which by the way is funding everything through our taxpayers' money, should be ordered to stop today using non-gendered terms to try and be woke, which actually don't refer to the actual people they're treating? If it's women's healthcare, the word woman needs to be rather crucial in that advice.
Yeah, no, absolutely. I'm the Women's Health Minister. We've introduced the Women's Health Strategy. We've been clear throughout that. If you look at anatomical wordings within the strategy, it relates to women. The government can't force NHS trusts.
Why not? If you're funding them, why not? Why can't you say, you know what, if you're going to do this, you don't get any funding. They'll stop it tomorrow.
Well, that's the operational setup of the NHS, but we have been pretty clear, and certainly as the Women's Health Minister, that we talk about, only this week we've announced a pilot study for women affected by endometriosis, which is affecting their ability to go to work, as one of the points that you made, and we're funding a pilot study to support both workers and their employers to improve that. So we are, I'm very focused on that. I'm a Women's Health Minister and the Women's Health Strategy, and I absolutely do share your concerns about some of the languages used, and both the Health Secretary and the Prime Minister have also been pretty clear that biology matters.
Well, yeah, it absolutely does. Maria Caulfield, thank you for that. I think the government could do a lot more on that front. Minister for Health and Social Care there.